Welcome back. It's time for Mental Health Monday with LSF Health Systems. Erin Whitaker-Hauk is the Associate Vice President of Clinical Program Operations at LSF Health Systems. And this week is National Public Safety Telecommunicators Week. So let's talk about it. Hey, good to have you back.
Thanks.
It's very good to see you. So explain the day-to-day of a dispatcher, right? So I can only imagine how crazy that is.
Yeah, so 911 dispatchers, they really are in the unique position of being the first responder, right? They're the lifeline between, the caller in distress and the first responders who are going to provide care. So in the day-to-day, they answer 911 calls. They have to assess the situation quickly and then dispatch appropriate resources to the scene. So that requires collaboration across a number of agencies, like law enforcement and fire and medical personnel. So yeah, it's dispatching that so there's an effective response at the scene and it happens quickly.
Right, and I can only imagine how stressful that is because the person that's on the phone typically is in a situation of distress, and so you have to remain calm while they're not, and then find a way to connect the dots, which has got to be just amazing. So, in what ways do the demands and pressures of their profession impact their overall mental well-being? So how does that affect their mental health?
Right, so every day they are the first point of contact in emergencies. So the weight of that coupled with the intensity of the situations that they handle can be emotionally taxing. The stress and trauma of their job really can manifest in a number of different ways, like alcohol or other substance use, relationship problems.
They try to numb the pain.
Right. Other mental health conditions like PTSD.
Gotcha.
The reality of it is more first responders will die by suicide than in the line of duty.
Wow.
Yeah, and so that's just a stark reminder of how the stress and trauma they experience day in and day out every day impacts their overall well-being.
Yeah, I can't even imagine if you to deal with that 5 days a week, how that couldn't affect you on your time off. Like you're a person.
Absolutely.
Okay, so what are some of the key warning signs that dispatchers and their colleagues should look out for when someone might be struggling with their mental health?
Right, so emotional outburst, if they get really angry, if they're tearful, or on the flip side of that, if they're numb, you see numbness, detachment. You may see changes in work performance, so increased errors or distractibility, change in work habits. They're calling in sick or avoiding shifts, or they're just really distracted and
like
detached.
Fundamental switches in their personality.
Right, or even appearance changes. Maybe they start to neglect hygiene and personal grooming.
Right, okay, cool. And so what resources or programs are available for dispatchers and other first responders, that want to seek counseling? Where do they go?
Yeah, so peer support is really invaluable for our first responders, right? So having someone who understands what you've gone through, who is a former first responder, it provides a safe space, free of judgment, where they can go and talk about what's going on with them and get that help. So LSF Health Systems, our first responder peer support program, is staffed by former first responders.
That's amazing.
It's free, it's confidential, it's outside of their agency, so there's no fear of repercussion or anything like that, getting back to their superiors.
Absolutely.
And so, yeah, if you're a loved one of a first responder, you're able to access that service as well. It's not just the first responders.
I love it.
So current, former, or family members of first responders, you can certainly get help.
Thank you,
So
Erin.
just, if you need help, just call 211 or visit our website at stayfitforduty.org.
I love that. Thank you so very much, guys. Stick around. We'll be right back.